It's 4 o'clock on November 14th, the day before deer season starts. I'd like to call the meeting of the Bay County Board of Commissioners to order. Could you please take the roll?
Durancheck.
Here.
Krieger.
Yes.
Big Ick.
Here.
Coonan.
Here.
Ryder.
Here.
Lutz.
Here.
Chairman Herrick.
Here.
All members present.
Please stand for the invocation and pledge.
Almighty and eternal God, governor of all things in heaven and on earth, we ask that you will bless this county commission this day. We ask that you lead and direct this board to work for this county, and that you grant them the knowledge and understanding of the needs for this community. In your holy name we ask this. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First on the agenda today is the minutes from 10/10/17 and 10/17/17.
Motion approved. Support.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Motion carries. Next, we'd like citizen input. If there's anyone from the audience who'd like to come forward and address the commission, now would be the time to step up to the mic. I see no one. We'll move right on to petitions and communications. First thing will be the update on the Bay Community Health Clinic for our health director, Mr. Strauss.
Thank you, Mr. Chairman. Today I wanted to take the opportunity. We've had questions in the past about how the Bay Community Health Clinic, formerly known as University Clinic, operates. And so I really want to give some background and tell you the details of how we partnered with Saginaw Valley State University to create an integrated behavioral health and primary care clinic to deliver holistic and comprehensive services. The health clinic is not a free clinic, and it's also not a fee-for-service clinic in and of itself, although we do charge fees and we do charge insurances. It's truly an interprofessional clinic, and it has a full complement of nurse practitioners, nurses, social workers, medical assistants, occupational therapists, and pharmacists. And they offer an integrated type of care that is pretty unique, not only in public health. We are the only interprofessional primary care clinic that's attached to a health department in the state of Michigan, and maybe for the United States for that matter. But it's also one of the only interprofessional clinics within the state of Michigan itself. Patients are cared for across the spectrum of their healthcare needs, and the workers that work in the clinic play an integral role in the delivery of therapy to a variety of patients, but many with mental illness, but they're involved with all patients, from health coaching, motivational interviewing, to help them achieve optimal health, and supporting the entire team in management of patients who may not meet the threshold for meeting the criteria of receiving services elsewhere. Today's presentation, I want to talk to you about three basic things. Number one, how the clinic came into existence, and talk to you briefly about the challenges of providing health care in Bay County. Second of all, I want to spend some time talking about what the clinic has accomplished, especially in regards to the partnership that has evolved with the university and Bay Area Behavioral Health. And then finally, I want to close and discuss some opportunities and challenges that are taking place. First thing I wanted to talk about briefly here is the need for primary care in Bay County. If you may not be aware, but every 3 years we do a community health assessment. We perform a community health assessment here in Bay County, and we do this in conjunction with Bay Regional Medical Center, McLaren Bay Health, the Bay Area Behavioral Health, Community Foundation, and Great Lakes Health Centers. When we first started to track the number of primary care providers in Bay County, that number was, for every one primary care provider, there was 1,737 residents. If we compare ourselves to Saginaw and Midland, their numbers are pretty significantly lower. Saginaw's about in 2013, it was 1 to 1,000 1,183. Midland was pretty close to 1 to 1,162. The state average was about 1 to 1,271 people, but the top performing counties in the United States at that time was about 1 to 1,067. Those numbers have gotten better throughout the nation and throughout the state and our region, but those numbers have gotten worse in Bay County. We're at 1 to 1,900 residents. And this slide demonstrates two things. Number one is Bay County is losing primary care providers over time, and that we are also in a proverbial rock and a hard place, because in order to obtain any kind of automatic federal assistance for need of primary care providers, you have to be at a 1 to 3,000 ratio. And typically you find those in urban areas, depressed urban areas, or depressed rural areas. And we're not close to that, and I don't want us to be close to that, but we're also, as I said, it's between a rock and a hard place, because we're not receiving any more federal or state assistance because we have lower numbers. While this table illustrates primary care, there are several shortages also among certain specialties, and among them are urology and endocrinology and a variety of other different things. If you're on Medicare, or excuse me, Medicaid in Bay County, and you need to see a urologist, well, you will probably have to travel outside of the region, because there are no urologists that currently take Medicaid. If you have a child with diabetes here, you can see an adult endocrinologist, but you cannot see a pediatric endocrinologist, because there are no pediatric endocrinologists within our region here as well. And there are shortages in a variety of other specialty areas as well. Now, one of the good things, though, that has happened here is that we have really seriously cut the number of uninsured adults pretty significantly with Medicaid expansion. And on the bottom there, you'll see that there's about 19,000 individuals on Medicaid, and about 25,000 Medicare beneficiaries. So if you add those up, and that's nearly half of our adult residents or residents here in Bay County are on some sort of public payer system at this given time. Additionally, there's at any given time, there's about 4,000 to 6,000 people that are uninsured for a variety of reasons out there. And those people have a hard time trying to obtain care. So it's a challenge to provide care throughout the community on this. The one thing, and I don't want to spoil the rest of the thing, but in spite of these disparities, some of the work that we're doing at the health department and throughout the county, we've seen our county health ranking go up to 34 out of 83. There's 83 counties, and we're considered by the Robert Wood Johnson Foundation the 34th healthiest county. Saginaw is in the lower 70s, and Midland is in the top 10. But this is pretty up significantly because we were at number 53 in 2013. So the clinic origins happened in 2013, and it happened as a result of, we gave a variety of different presentations on our community health assessment and the need for primary care. And we were approached by the folks at Saginaw Valley State University College of Nursing because they wanted to implement an interdisciplinary style clinic system where they could teach their nurse practitioner and nursing students and occupational therapy students in an interprofessional manner. But they also had the need to place their students throughout the community, and they had a hard time doing that. So Saginaw Valley took the lead. They submitted a grant to HRSA, and they were originally awarded in 2014 this first grant for about $1.5 million. That grant helped establish what was then called the University Clinic, and it had the 5 main disciplines there of nursing, health science, social worker, pharmacy, and occupational therapy. And as I said before, Bay County is the only health department in the state of Michigan with an interprofessional primary care clinic within its operations. In 2016, 2015, the university submitted 2 more grants to HRSA and a grant to we submitted on their behalf a grant to the Michigan Health Endowment Fund to expand services to include people, persons with mental illness, especially folks that were receiving care through Bay Area Behavioral Health, those that have strong persistent mental illness, and even those with moderate mental illness. So a key objective of this project is to improve access to care delivery models that integrated both primary care and behavioral health. And to judge the effectiveness of the efforts to meet the objectives with the second grant, we started collecting data at the beginning of the project, which was last July, and then again this July as well. And over that span of the year, we saw a 33% increase in patients from 177 to 236 who had established care. Now, that doesn't mean that everybody that came through the clinic is an established patient. Sometimes we see people just one time. Sometimes we see people for a couple of visits, but then they don't establish care with us. So we have 236 in the amount of, at the time frame of July 2017, that we're receiving established care within the clinic. That number has risen significantly since then. And we've had amazing success with community outreach events, and we've been having between 10 and 20 new patients per week. And much of that growth is driven by the close association with Bay Area Behavioral Health, which I'll talk about on the next slide.
Joel, what's the definition of established care?
That they're not just there for one visit, that they're there for at least 3 or more established visits. They come back, and we are trying to manage their chronic conditions. One of the key things with this, with our particular clinic, is that we're focusing on persons with multiple chronic conditions. So they might have a mental health disorder, or they may have heart disease, but they're also suffering from diabetes, hypertension, emphysema, you name it. So it's well known that individuals with serious and persistent mental illness have higher morbidity and mortality, in part due to poor management of their chronic health conditions. For persons with SPMI, serious persistent mental illness, generally tend to live 18 to 25 years shorter than the average person does. So part of the motivation for establishing this integrated clinic was to directly address this disparity. The goal of the work is to work with behavioral health and other community partners to identify those with SPMI that had comorbid chronic conditions that hadn't seen a primary care provider in the past 12 months. Obviously, these are individuals who are at the greatest risk for complications and overuse of health resources. Hypertension and diabetes are the 2 health conditions that we chose to focus on this project, and we'll talk about some of the things that we've been able to accomplish with that. So what we're looking at here is a direct result of the partnership that with behavioral health, when recognizing that as a patient is without a primary care provider, that they've been funneling them to our clinic to establish care. So when we initially established the clinic, about a quarter of new patients had not seen a primary care provider in the past 12 months. But now, because of the success to connect SPMI patients with our primary care, the numbers have increased, so now fully 1/3 of our patients that were previously without primary care have so now. So one of the major accomplishments that we were able to achieve in 1 year's time was to reduce the number of our clients that have hypertension and or diabetes with ER visits in a 12-month period. And that went significantly down, 46% reduction from 41% to 19%. So in our SPMI patients who have either diabetes or hypertension, we've had considerable success reducing this overusage of the emergency room. And if you recall, in the past I talked about an average emergency room use visit cost anywhere from $900 to $1,500 to even more dollars per visit. 41% of our visits had at least one inappropriate ER visit, and 1 year later this is down to 19%. It's a very important measure of success in terms of saving valuable healthcare dollars, as emergency services are very expensive. And I'll talk to you too later as we go on the presentation why we're hoping to see some benefits with the reduction in health disparities here. One of the key efforts that we integrated in the clinic was to initiate universal screening for depression and substance abuse. We have quite a number of folks that do come into the clinic and they are shopping for drugs. As you all know, we're in the midst of the opioid crisis here, and we have a lot of residents and people that could be potential clients that are, quite frankly, shopping for drugs. So we screen them right away. We don't turn people away. We try to help manage their pain, but we will not fill controlled substances requests just to continue the addiction that is taking place. We'll try to get these people into treatment. At baseline, no one received screening. 1 year later, 80% of the patients now receive universal screening. We're almost there at 100%, but not everybody that comes through the doors is quite eligible for this. But once screened, the social workers are integral to follow-up. For those with mild to moderate depression and substance abuse, 100% received a same-day full assessment using validated screening tools and appropriate interventions that were planned, including perhaps antidepressant medication and brief intervention. If a patient is thought to have severe and persistent mental illness, a full assessment is conducted by social workers quite quickly, usually within 3.5 days, as compared to 11.5 days prior to the initiation of the clinic. For diabetes outcomes for folks that have serious and persistent mental illness, we have seen quite a reduction. Here we're focusing specifically on one of the two target conditions, which is diabetes. In all diabetic patients, we have a very specific clinical benchmarks for that we try to achieve, and that's a reduction in the A1C. So on the left, we're looking at how diabetic patients who are also SPMI stacked up to those compared to these benchmarks. The national benchmarks for each of these measures is 50%. And so as you see here, we've exceeded national measures in all areas of diabetes care except the annual eye exam. When this was determined to be an external problem and that patients are unable to get appointments with an ophthalmologist for an eye exam. So here's another example of a specialty condition that is currently having shortages within the area. But we continue to make strides in all of these areas. On the left, we're looking at clinical outcomes of diabetic patients who are considered to be in poor control. And kind of the benchmark is you don't want to have anyone with diabetes having a hemoglobin A1C greater than 9%. And of the 40 SPMI patients who have diabetes and receive care at the Bay Community Health Clinic for this past year, only one was deemed to be in poor control. And adjustments were made to the treatment plan so that their hemoglobin A1C is now considered to be in a safe range. So the key objective of this initiative is to provide a unique training ground for future health professionals. And as part of an interprofessional team, the nurse practitioners work with social work students along with students from nursing, occupational therapy, pharmacy, and health science. Students learn critical skills to facilitate a patient-centered team approach. And to this date, over 60 students from SVSU, Ferris State University, Michigan State University, and Wayne State University have had a clinical immersion experience at the Bay Community Health Clinic. And after graduation, they are able to apply these valuable skills at their new practice setting, thus perpetuating this unique model of interprofessional care integration. Now I want to talk about future growth and opportunities and some of the challenges that we have. As far as future growth and opportunities, I'm proud to say now, thanks to the hard work and efforts of my staff, is that we are fully credentialed for Medicare. So we're now able to see folks with Medicare, and especially folks that have both Medicaid and Medicare. So we're both able to leverage those funding sources as well. We are seeking a patient-centered medical home status so that when opportunities arrive for accountable care, to become an accountable care organization or accountable care funding, that we will be able to qualify for that. But also we're seeking care coordination agreements with some of the Medicaid managed healthcare plans, because we want to be able to demonstrate them the effectiveness of the care that we're providing within the clinic, and also to be able to enumerate the savings that they're seeing within these patients themselves. Future opportunities listed on these slides, as I stated before, include accountable care organizations, future funding that reimburses towards the outcomes of care rather than a fee-for-service model. The challenges are pretty significant, though. In Michigan, Medicaid expansion will reach its 4-year birthday in 2018. And in April of 2018, beneficiaries will be required to start paying co-pays, deductibles, and must submit to program requirements that reflect work status, et cetera, or be dropped from the rolls of Medicaid. And that's a pretty significant amount of the population. We've seen a pretty steep increase within 2014 and 2015. Currently, there are very little to no incentives for the managed health plans to maintain enrollment in these areas. So that's one of the challenges that we're facing on this. We're also facing challenges within funding cuts at the state and the national level. And what happens in Washington will no doubt flow directly here to Bay County, to the state of Michigan, and into Bay County. But despite all of that, we've been able to accomplish this without spending $1 of general funds. And it's one of my proudest accomplishments here at the Health Department. But I do want to specifically thank the County Executive, Jim Barsha, and the Board of Commissioners, yourselves, for supporting this project. I also do want to give my thanks to Saginaw Valley State University, and Dean Judy Rulin, Dr. Kathleen Schachman, and especially Chris Chesney, who came on board in the last few months and has really provided some much needed assistance and leadership within the clinical setting itself. And finally, the partnership wouldn't be complete without Bay Aranac Behavioral Health Authority as well. So with that being said, are there any questions?
Commissioner Bikick.
Yeah, had a chance at the Health and Human Services Committee meeting of MAC to talk about our program, and nobody else had a program like you say. So some of the other counties seem interested. I mean, they have universities in their counties also that they could do this type of program. So I think it's, and I agree about the Medicaid finding providers. We have to send people down to Flint and Detroit sometimes for specialty. Dermatology is one of them. I know Flint, we have to send a lot of them down that way. There aren't many local ones that take the Medicaid. That's a problem.
I think that's going to be a bigger challenge for us as time goes on.
Anyone else?
I just have a comment.
Yes.
Mr. Chairman, I want to thank you, Joel, and your dedicated staff in the Health Department for, I think, providing Bay County residents with this a cutting-edge type of innovative healthcare delivery system for the uninsured. And it helps even McLaren Bay, because if these people end up in the emergency room and they're uncollectible, if they're not on Medicaid, then our local hospital has to cost shift to pick up those additional costs, because federal law requires a healthcare institution that accepts Medicare or Medicaid to provide care without regard to ability to pay for that care. And the recent event that we had at the Health Department with President Don Chand was, I think, recognizing kind of the efforts that all of you have made, and it truly is a collaboration with Saginaw Valley State University and Bay County, and truly is unique. So I applaud the Board of Commissioners and yourself for launching it in Bay County, and it certainly is recognized as, I think, an absolutely phenomenal program for our residents, and it's a win-win for the students as well. The Health and Human Services or Sciences students at SVSU who have an opportunity to interact with real patients and to gain that valuable experience before they complete their degrees and go out into the job market in the healthcare field. So thank you, Joel, for the tremendous job that your leadership and all of the dedicated staff at the Health Department in really putting Bay County on the map, I think, in terms of healthcare delivery to underserved populations and residents.
Yes, thank you. And I would be amiss, I forgot to mention my own staff, that really none of this could have happened without their support, hard work, and dedication.
Thank you, Joel. It was great. Congratulations, Mr. Barsh said, congratulations. It's a lot of work, and the staff is great. You're doing a great job. Thank you so much. I need a motion to receive, please.
Motion to receive.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Next up, we'll have an update on the Wellness Center from Jeannie Deckard. Another one of our projects that somebody works hard on.
Thank you. We just want to give a brief update on the Wellness Center and how everything is going over there. As you know, we implemented in 2014, and it is still under agreement with Dr. Potts and Total Family Health Care. Our goals continue still to be preventative health care. That would be getting people to go to the doctor. As you know, we did change our plan, so we do not require people to go to have the lower deductible plan. We changed that in 2016. So now people are just going on their own annually. So that has been a very positive outcome of the Wellness Center. Also, non-routine urgent care. People can go to the Wellness Center for colds, stitches, they can have moles checked, that kind of thing, and that keeps people out of urgent care in the ER. So that's saved a lot of money for our staff as well as the county. Diabetes management, heart conditions, anything disease management. People can go there and talk to, every Wednesday they have a class for diabetes, so people can go and participate in that. And the Wellness Center staff also refers people out to other counseling that might be available. They do follow the patient-centered medical home model, like Joel had mentioned, for the health department, that's seeking their model for them. And that is anybody that goes to the Wellness Center that might go to a heart doctor outside of there, the Wellness Center coordinates with that physician so that they can communicate in regards to any testing or anything that needs to be changed or medications. The benefits to the employees for the Wellness Center, they do not have a copay, whereas if they went to a different physician, it would be $30 on the base level. Generic medications continue to be free, and those have increased. It's pretty much all generic medications now. The ones that people would have to pay for would be the higher end medications. There is 4 locations, the Bay City one, Auburn, Midland, and now there is Saginaw, and that opened this year. The biggest utilizers, of course, are Bay City and Auburn. Midland did change providers, but there's been quite a few people starting to go out there as well. And Saginaw increased their hours. They began this year, so they have a full-time provider out there for anybody in that area. They can utilize that facility now. Extended hours, we do see most of the people that go anywhere from 12 until 7 on various days. I know Wednesdays for sure, the Wellness Center is open in Bay City until 7 o'clock. So I do track all of the hours from the reports that they send, and that is the main time that people go, is between the hours of 12 and 7. And Mondays is the biggest day that people seem to go to the Wellness Center. Like I had mentioned, the health counseling, they refer people out. One-on-one, you're basically in the room with the physician and you are free to talk about whatever you need. She's not kicking you out. Like, you can be in there for half an hour if you need to. There's shorter wait times in the waiting room. I know I've had a lot of comments about that. The comment about the cost-effective testing, when they refer somebody out for like an MRI or an EKG or anything that they can't do inside of their office, they find the provider that has the best rate with Blue Cross Blue Shield, since that's our provider for our health insurance. We bypass the Blue Cross Blue Shield system in terms of the office visits, preventative labs, and the prescriptions still go through EHIM, but those are on a lower rate. We have a separate plan with them for the Wellness Center. We did implement in the Auburn practice MDOT physicals for anybody that has a truck driver or needs that on their driver's license, so that is free. Whereas outside of the Wellness Center, You could be up to $120 to pay for that. Sports physicals also, and the biggest thing is the employees do not pay anything on the back end for the Wellness Center. And thanks to you, we don't have that again this year. So this is where we're at through September of this year. And as you can see, about 267 employees have went, 69 of the pre-65 eligible retirees, 119 dependents, and the 98 spouses. So the spouses are both retiree spouses and eligible employee spouses. And that's just for this year. Our new appointments and return appointments, as you can see, the first year there was a lot of new appointments in regards to people going initially, and then it has since decreased off. The return appointments, the last for 2017 is just through September, so that's why that may look a little bit lower. We do see an increase in people going. We paid over $14,000 for our file fee, and that is the $18 file fee for every new patient that goes, and we'll see that still trickle off because we've paid for about 70% of the eligible people.
On that graph, on the left-hand side, what do those numbers mean?
Those are the appointments that have went. So
1,600?
for the whole entire year.
Wow.
Yeah, so between the return and the new appointments, that's about how many has went for that particular year. And like I said, for 2017, it's just a 9-month figure, so that'll increase because we still have, well, October, November, and December to add to that. So this is our office visits, and our current copay for our employees is $30 for office visits, no matter where they go, except for the Wellness Center. And for non-preventative routine visits where you might go for a cold or strep throat or something like you might have a heart condition going on, you would normally pay $30 outside of the Wellness Center. So we have saved the employees, the employees have saved over $153,000 just on co-pays because they're not paying that by going to the Wellness Center. So with that, that is over 5,000 appointments. And the other preventative appointments, which are free for an employee to go to at any physician, were just over 1,200. So they don't pay for those regardless of the Wellness Center or their own physician. Yes.
And maybe you're going to get to that, Jeannie, but if we're saving the employee that amount of money, then all of those visits are not being charged to Blue Cross.
Correct.
Therefore reducing our overall cost. Is that a number that you're going to be able to come up with?
Well, it's just, it would be kind of hard to come up with a number. Obviously, we're self-funded, so that's where your point is. Like if somebody went to their physician for a cold and they paid $30, on the back end, we would pay maybe $80 with Blue Cross Blue Shield. So, I mean, if you figure we're saving over...
So that's
like
a significant amount of savings.
It is. Like maybe, well, depending on what they went for, it
Sure.
could be over $400,000
Yep.
since 2014. It's just hard to say exactly how much Blue Cross would have charged for that specific visit because they have their negotiated rates, but we don't know exactly what they went there for. So yes, that is a significant savings on the back end as well. Thank you for asking that. These are our contracts to date. Our eligible contracts are in blue. Those are all of the employees and the pre-65 retirees that can go. This is not including their spouses. This is just the employees and retirees. And then as you can see in the red, those are the ones that have participated in the Wellness Center. And by looking at the graph, you can see we're about 3/4, 67% or so of utilization. So with that being said, this is our utilization since 2014. Again, the 2017 figure is only 9 months worth, so that's why that's a little bit lower. So we've been pretty consistent with the 67% of the contracts that are utilizing the Wellness Center. And the contracts by location, I kind of did a figure on this just to kind of show you that maybe the other 30% aren't going to the wellness center because they don't necessarily live in a convenient location. 324 of the contracts that can go live in Bay County, and then outside of Bay County is about 80. Now that doesn't count the kids that are at college, the husbands that work out of town, a child that lives with a parent in a different city. That just counts our employees' address, so for that contract. So about 80% are in our area and 20% commute to the area. So our contract savings since 2014, this is where we were in 2014. When we negotiated the agreement with Dr. Potts and Total Family Healthcare, we did it on a scale. So in 2014, we started by saying we'll pay you for 125 contracts per month, regardless of however many people go. And then we would pay for the people that went on top of the 125. So by the end of the year, we were paying for more than 125 contracts per month. But our initial plan was to pay for 125 in January, regardless if 50 people went or if 125 people went. So then in 2015, our agreement with this contract was 200, and then in 2016, our agreement was 250 contracts. So in 2016, we paid a minimum of $10,562 a month just to say that many people were going to go. Our new agreement with Total Family Healthcare and Dr. Potts is $150 a month, and it's a flat rate throughout the whole year. So if 175 employee contracts go in July, we still are only paying $150 for the rest of the year. So that saved us over $4,000 every single month. So it's about a $50,000, $60,000 savings per year just for that new agreement with the contracts. And just on a side note, with how the contracts work, we pay $42.25 a month per contract. So say I'm a family of 4, we pay $42.25 for my family, regardless if we all go or if I just go. Does that make sense? Okay, because I had to re-explain that to some people, and I just wanted to make sure everybody understood how that worked. So now we're paying the $6,337.50 per month for the contracts for our next 3 years. So 2017 through 2019 is what we agreed with the Wellness Center. So there won't be a staggered amount of contracts now. So that has been a significant savings. And with that $42.25, it's January through December. So if I don't go until July, then we only pay for me, my contract, and my family from July until December. We don't pay January through June for me because I never went. So that right there, saves the county money because it's only January through December. It starts over in January for the whole entire contracts. Some feedback from employees, they're really happy with the providers. The ease of getting in and out of the Wellness Center, they take walk-ins, that's been a significant thing, the wait times. And the last one of the comments was, we have been coming to the Wellness Center for a couple of years. My wife, myself, and our daughters are pleased with the prompt and professional service. So we do get a lot of feedback each month from the Wellness Center because they do provide us with reports and they send them to you folks as well. And I do have many spreadsheets if you guys are ever interested in seeing day of the week, times, what they're being referred for, anything like that. If you want to see it all on one sheet rather than looking at every single month's reports, I'd be happy to share that with you as well. So I want to thank you for your continued support with the Wellness Center. I believe it's been really beneficial for all of our employees, their spouses, and their children. And does anybody have any questions?
No questions? Jeannie, I just want to say, a lot of people don't realize we know the wellness thing that you do, but all the other things that go on in the building, for the employees, I don't know if it's all over, but I know it's here. You got stair walkers, you got, you got special food days, that come up, but you're always trying. I know you promote a healthy lifestyle for all the employees in the county, and that's a great thing. The Wellness Center has worked out well for you know, everyone involved. I mean, it's been a good thing since the board got involved in a few years ago, and, you know, even though healthcare has gone up, it hasn't gone up as much as it could have if we didn't have the wellness center, you know, so it's been a great money saver for the county in general. But thanks for all you do. Mr. Barsha, did you want to say something?
Yeah, I'd just like to add to the chairman's remarks and commend the Board of Commissioners for initiating the wellness program years ago, and say again, like the clinic, and also this coming spring, hopefully in 2018, the dental services that will be offered to many residents in Bay County. What you've done with the wellness plan for county employees is recognized as tremendous, and I hear nothing but positive. I've been in this office 10 months, and everybody loves the wellness plan, so keep up the great work.
Thank you. Need a motion to receive.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you, Jeannie. Next, we go to reports and resolutions of committees from the Ways and Means. Commissioner Lutz.
Thank you, Mr. Chairman. Today I bring before the Commission Resolution 2017-236, acceptance of various court grants from the Circuit and District Court. I move that resolution.
Support.
Discussion. Commissioner Coonan.
I think at Ways and Means, I asked if we could get the previous year's grants, and maybe Deanne going, I mean, if they're not going to provide it to us, which I think we should see. Maybe when they provide that information to you, you can say, get us last year's as well. So as a board, we can see what last year's was, what this year's is, and just, it's good information.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-237, the voluntary disclosure agreement from corporate counsel. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-238, the renewal of our property and liability insurance with the Michigan Municipal Risk Management Authority from Administrative Services. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-239, request for qualifications for independent contractor from Veteran Services Office, Veteran Services Coordinator from Administrative Services. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-240, the amendment of the independent contractor agreement with Crystal Latimer from Administrative Services. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next, we have Resolution 2017-241. It's the negotiation of softball contract for recreation and facilities. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed, same sign. Motion carries.
Next is Resolution 2017-242. It's the bid for lease for parking lot spaces at the from recreation and facilities. I move that resolution.
Support. Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-243, the adult foster care home lease agreement from recreation and facilities. I move that resolution.
Support.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-244, the RecPro recreation software from recreation and facilities. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-245, the Blue Cross Blue Shield Schedule A from personnel. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-246, Employees' Health Care Contribution Rates for 2018 from personnel. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next, I bring Resolution 2017-247. It's the Wellness Administrative Procedures, Bay County Employees and Retiree Recreation Benefits from personnel. I move that resolution.
Support. Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is a request for Resolution 2017-248. It's the request for proposal for the Medical Director Services and Medical Examiner Services from the Health Department. I move that resolution.
Support. Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-249. It's Amendment Number 1 to the CPBC Agreement from the Health Department. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next, I bring Resolution 2017-250, the Generator Maintenance Agreement with Wolverine Power Systems from the 911 Central Dispatch. I move that resolution.
Support. Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-251, Payables, General, Bayonet, Center Ridge Arms for Finance. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next, we have Resolution 2017-252. It's the budget adjustments of various departments for finance. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next is Resolution 2017-253, request for proposal for a 3-year cost allocation plan from finance. I move that resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Next, I bring Resolution 2017-254, the amended 4029 for 2017, apportionment from equalization. I move that resolution.
Support. Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
And that's all I have from Ways and Means, Mr. Chairman.
Thank you, Commissioner Lutz. From the Personnel and Human Services, Commissioner Ryder.
Thank you, Mr. Chairman. We have Resolution 2017-255, My Community Dental Centers. I move that resolution forward.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
Resolution 2017-256, vacancies in the Sheriff's Department, Department on Age, Equalization and Building and Grounds. I would move that resolution forward.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
That's all we have before you today, Mr. Chairman.
Thank you, Commissioner Ryder. From the Board of Commissioners, Commissioner Durancheck.
Thank you, Mr. Chairman. We've got a busy agenda here. Resolution 2017-257, reports of the county executive. I move this resolution.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed?
That's all we have, Mr. Chairman.
Motion carries. Reports to the county officials and departments. County executive.
Just a couple of things, Mr. Chairman. Wanted to let everyone know I'll be attending the press conference on December 1st in Washington, D.C., in which we'll be announcing on behalf of the County Executives of America organization with selected counties throughout the United States. And thanks to our Bay County Board of Commissioners, Bay County will be part of that litigation. And we'll be unveiling that on December 1st. And just wanted to let you know, and we'll report back when I return. Then one other item that I have is my executive assistant position in my office has been filled, and she's in the back of the room, and I'd like her to stand and be recognized, and that's Rebecca Gregorczyk. Charbonneau. So Rebecca, welcome. And these are the commissioners that you'll be working with in the months and hopefully years ahead. Thanks.
That's all?
Yeah.
You're done? Wow. Okay.
It's hunting season.
Next, Administrative Services Director. Would you like to say anything about the, or just want us to receive that?
I would like you to receive it. I'd like you to review it and spend some time reviewing what we have prepared over months of our gatherings and listening to experts in the field of animal care and treatment and our local experts that contributed so much to our efforts. So hopefully you'll have an opportunity to look at it and see what we've accomplished, what we hope to yet accomplish in improving our saving of lives of animals within our community and the outreach efforts that we're making. And it's a work in progress, and your opinions are all very important, and any comments you have or recommendations, we certainly take those into consideration.
Move to receive.
I just want you to know, I read that. I read it today. I read the whole thing today because I needed to, and it's very interesting. And there's a lot of information there, and I know all the work that you put into this thing. I mean, you spent a lot of time on this project. So as Mr. Barsha, there's and a whole bunch of other people that I don't even know. But I know, I see you two all the time. But there's a lot of good stuff in there, and to implement the whole project that's the next phase. So everything's down on paper now, and I know it's one piece at a time, but it's a great thing. Anyone else? No more. All in favor?
Aye.
Opposed? That motion carries. And we need to receive Bay County TV, the Bay County TV statistics. We need a motion to receive.
So moved.
Support.
Any discussion? Not seeing none. All in favor?
Aye.
Opposed? Motion carries. Is there any unfinished business? New business. I have one thing. I just want to mention that yesterday, the clerk submitted a action for the board on credit card contracts, and I know it's kind of late, and we all have a lot of questions, and I just wanted the clerk to know that we're going to review it, and hopefully by next Ways and Means Committee we'll have something, and we'll be able to look at it, and maybe we'll be able to put something together. But so we're going to take some action on it. Just won't be. It can't be today. It's just it's kind of late, but so we all have the information now, and we'll work with it. That's my new business. Any miscellaneous? Commissioner Begic.
Just wanted to report the Michigan Association of Counties Board of Directors met with Governor Snyder last Tuesday. We had some questions for him, just briefly. County revenue sharing was number one. He says the budget's going to be tight next year. Don't expect any raises. No more extra money floating around. So personal property tax is still an issue. Some counties got quite a bit back, more than they had lost, so they're looking at personal property tax redistribution. TIFA is still out there. I think Senator Horn has a bill pending about the TIFAs and the concerns about the special millages going to some of the TIFAs like libraries and whatever. Take a look at that, and also have the counties more say in the TIFAs, change the process. And then broadband was the last issue. We brought up broadband access, and I know a lot of people have been talking about it, the city's been talking about it, and they're looking at broadband, increasing it whatever way they can. They don't have any definite plans yet, but they're still looking at it. That's all we had.
Thank you. Any more? Any announcements? No announcements. 2017 appointments. In December, we have the Department on Aging Advisory Committee. There's 4 two-year terms in districts 1, 3, 5, and 7. Is there any need for a closed session today, ma'am?
There is none.
Perfect.
Motion to adjourn is always in order.
Support.
All in favor?
Aye.